Let's now look at some of the modifiable risk factors, the ones that we can make efforts to change. The first one is physical inactivity. Being sedentary or not moving enough has been associated with an increased risk of developing cardiovascular diseases. Tobacco use is the second modifiable risk factor. Now, this use of tobacco includes smoking and even sniffing of tobacco products. Smoking increases your risk of developing atherosclerosis, and the nicotine in tobacco also increases your blood pressure. Women who smoke are at a higher risk of developing a cardiovascular disease than men who smoke. It is estimated that smoking increases the risk of strokes, coronary heart disease, and impotence by 100%. Stress has also been shown to be a possible risk factor for the development of cardiovascular diseases. This is because living a stressful life often pushes people to adapt negative health practices such as poor eating habits and smoking. Being stressed itself can have a negative impact on the body, especially the nervous system and the blood, and it changes the way in which the body functions. Hypertension is the number one risk factor for developing a cardiovascular disease. Having high blood pressure stresses the body's blood vessels and could cause them to clog or to weaken. Hypertension is called the silent killer because it usually has no warnings or symptoms, and a lot of people do not know they have it. The fifth modifiable risk factor is overweight or obesity. If your body has a lot of fat, particularly around the abdominal region, then your risk of developing a cardiovascular disease increases remarkably. If you have a lot of fat deposited around the abdomen, your body is not able to use insulin efficiently, and you may develop diabetes, which is a risk factor of cardiovascular diseases. Apart from your body mass index, which is a computation of your weight over your height squared to find out how much fat is deposited in your body, your waist circumference is also a very good indicator of your risk of developing a heart disease. For women, you should aim at keeping a waist circumference of 88 centimeters or less, and for men, 102 centimeters or less to ward off cardiovascular diseases. Your diet also plays a significant role in the development of cardiovascular diseases. A diet that is low in fruits and vegetables, a diet that has a lot of saturated and trans fat, and a diet that has a lot of sodium and salt puts you at a high risk of developing a cardiovascular disease. Excessive intake of alcohol and binge drinking have also been associated with developing cardiovascular diseases. Having high blood lipids or cholesterol is also a major risk factor in the development of cardiovascular diseases because it leads to the development of plaques in the arteries. Having a combination of risk factors increases your risk of developing a cardiovascular disease, and it's very important that we pay attention to the modifiable risk factors that have been listed today and work on them so that we do not develop cardiovascular diseases.